It's over. Hi, my name's Olivia. I am known as Olivia K on Facebook. I am known as Ollie K on Instagram. And I am also known as WarmYam9500 on Reddit. And basically, I do like to go online on these platforms and I try to help out people who will be taking the NCLEX because I believe it's a hard exam and I think it's good to hear from other people who have taken the exam and try to steer them to the right path on where to study and how to improve, because it's always good to have a community or one or two people who can be able to being inspired by another person, because I've taken the NCLEX exam twice for the RN. I failed the first time and I was completely discouraged, but I passed with the second attempt with under 50 questions, and I am glad I just passed. I don't even care that I didn't pass at 85, but I passed at 150. That's good enough for me. So, like I said, if I can pass, so can you. And you'll get there. Remember, if you failed the first or second or third, just know it's not a failure, it's a delay. Because that's not an easy exam. It's not. Anyway, so today I want to talk to you all about first versus best questions. I don't think it's talked about enough, and I feel like people should learn to practice and differentiate the two, because it's easy to get both first versus best questions confused. And I know that's what happened with me. So if you are able to differentiate the two, I promise you your scores will improve when you're taking the NCLEX exam. So I'll explain to you what both are in this situation. So when we're talking about first questions, it's priority based. And when I say that, it means that this patient is unstable and there could be a potential life-threatening emergency happening. So this is what you want to do immediately. And this is what Dr. Sharon usually means. If it's one thing you can do right now to at least save this patient's life, what would it be? What should you do to prevent a further complication? So there are usually keywords where you can tell that's a priority, like it's a first question. And usually they can either ask you, what should a nurse do first? Or what is the initial action of the nurse? What is the priority? What is the immediate action that the nurse should take when dealing with this patient? So that's how you can usually tell that's first. And it'll give you different options in the question. And then you'll want to know, then it'll help you decide, okay, this is what I should do first. And I'm telling you, the moment you're able to connect the keyword and the scenario, you'll be able to figure out your first action, and you will succeed. Then secondly, we have best. So that's most appropriate, and it's not, and it isn't urgent. It's not always going to be the urgent scenario. You want to know, like, out of all these questions, all these options that they give me in this question, what should I do? What would be better? Because I can do all these other choices, but what's appropriate? What's going to be therapeutic for the patient? So there are keywords that usually come when we're dealing with best questions. So that's most appropriate, most therapeutic, most effective. What's the best thing? So let me basically help you out with this one. When we're dealing with first questions, it's focusing on the safety and survival of this patient. So it's urgent, as I was saying just a second ago. Then you have best. Now you're just going to improve the quality of care. And like I said, it doesn't even have to be urgent. So let me give you 2 examples. Okay? So, I was talking about the pink frothy sputum patient in my last video. So in this case, we're going to use this in the first versus best questions. So this is an example of the first question. So this patient is coughing up pink frothy sputum. What is the nurse initial action? Notify the provider, apply oxygen, administer IV Lasix, or in the text it will be furosemide, or assess lung sounds. So this person is coughing up the sputum. So what do you want to do first? Out of all the choices I just gave you, you're going to apply the oxygen because ABC, airway, breathing, and circulation. So I talked about ADPI a few videos ago, last one or even a few videos before, and you want to use the nursing process. So the assessment is that we see the patient that has a pink frothy sputum. The nursing diagnosis is ineffective airway clearance, which I got wrong the last video, so I'll own up to that right now. Because they're having that issue with their airway clearance, they would need oxygen because it's going to help with the breathing. In the other video, I used the choice of putting a patient in semi-Fowler's position because it opens up the airways. That's what you would do first, then you would do the oxygen. But in this case, we don't have positioning. So the best thing in this case is putting the oxygen. So you want to also follow your ABCs, or wherever the question is presenting to you with priority, you want to figure out the type of priority that is going to help you in this question. So in this one's ABC, and there'll be other cases where you have to use Maslow of hierarchy needs, etc. Now we're going to do best question. Now I'm going to say the same situation here. The patient is coughing up pink frothy sputum. What is the best action to do for this patient? So I'm going to give you the same choices. Well, different actually in this case. Apply oxygen. Place patient high Fowler's and applied oxygen. Give IV Lasix or furosemide. Notify the doctor. See, that was a similar question I asked, but I did not have IV Lasix in my other video. So this one changes a little differently. So in this case, it would be Fowler's position, oxygen. Why? Because as I've explained in the last video, it improves lung expansion, and oxygenation. So that's the best thing to do because that's going to help the client breathe better, and then you're applying the oxygen. So again, that's how you can sort of like differentiate, and sometimes they'll give different choices depending on what the exam is looking for. So the best case or the best way to go about this is go on ChatGPT. That actually helps, though, believe it or not, and practice first versus best questions. Or if you have something like UWorld, it will allow you to practice priority like questions, because I know they have it there because I used UWorld for a good 2.5 months. But you can also go there and practice a lot of questions, and it will help you improve, and that way you're able to differentiate the two. Because if you, like I said, you're not able to answer each of those questions correctly, it's going to mess up your scores and you won't succeed in the exam. I'm telling you, you're able to answer first versus best questions, your scores will improve dramatically, and it will mean that you're 1,000 steps closer to passing. So just thought I'd make this video for you and help you out, and I hope this helps anybody who's watched this video. So I think for next video, I don't know if I'm going to have any viewers, but in case I do, you can let me know what else I should discuss. I think I want to go over NGN style questions or a bow tie, because I think people also kind of mess up with that one too. And I'm telling you, I hated it at first and I fell in love with them because of NCLEX Crusader. He's so awesome. He made me fall in love with NGN style questions. So anyway, I hope that so I'll do that next, and I hope this video did help you. So again, you want to practice on first versus best questions. You can do it through Chat GPT or through UWorld or whatever QBanks are using. Like I said, the more you practice, you can tell the difference between two, and you will do better when you take your tests, exams, or even practice exams. Anyways, take care. Have a good one. Bye.